Hello, my name is Dr. John Krempecki, and here at Cape Fear Eye Associates, I am the specialist in pediatrics and developmental vision. Today we are going to discuss strabismus, or commonly known as an eye turn. What is strabismus? Strabismus occurs when one eye is pointed anywhere else than the fellow eye, meaning one eye could be pointed straight ahead and the other eye looks like it's turned in, out, up, or down, or the other eye can be in, out, up, or down. Either way, both eyes are never pointed at the same position in space. Strabismus affects approximately 5% of children. However, adults can suffer from strabismus or eye turns as well. Adults more commonly from trauma, injuries, strokes, or what are called nerve palsies from uncontrolled diabetes. Today we're going to discuss eye turns in children. There are four basic types of eye turns. The first is called esotropia, or an eye that turns in to the nose. Esotropias occur for a number of reasons. Sometimes they're known as congenital or infantile esotropias. These are children who are born with an eye turn. One eye turns into the nose, usually common before age 18 months. Other types of eye turns typically present between age 2 and 3 years due to a significant amount of farsightedness in one eye or a significant amount of farsightedness in both eyes. Either way, the farsightedness causes the vision to be very blurry in one eye or sometimes both eyes, and the brain ignores one of the eyes, and the eye turns into the nose. Farsightedness is like lifting a heavy weight. It's not enough that we can lift the weight once, but can we lift the weight throughout the entire day? A small amount of farsightedness is like trying to lift 5 pounds the entire day. Not too difficult. A large amount of farsightedness may be significant, such as lifting 50, 60, or even 100 pounds all day long. When this happens, the eyes easily become fatigued, the eye turns into the nose, and the vision is ignored, and the information is ignored by the brain. Strabismus, or eye turns, are important to have evaluated, no matter how small, no matter if the appearance of the eye turn comes and goes or is present sometimes or other times. A comprehensive exam, eye exam, and strabismus evaluation is imperative. Another type of eye turn is called exotropia, where the eye drifts out away from the nose. This also can occur at an early age or even later on throughout lifetime. Exotropias are less common than esotropias in the early age, but still can be present at any time. Another type of eye turn is called a hypertropia, where one eye drifts up compared to the other eye, which is pointed straight ahead. This type of eye turn is more complicated to treat and requires special lenses and prism to correct the vision. The last type is called a cyclotropia, or an eye that rotates. Think about a clock dial. The eye actually rotates clockwise or counterclockwise compared to the other eye when looking at different directions. In, up, out, or down, all these types of eye turns occur with particular actions and movements of the eye muscles. Most of the time, eye turns are due to a disconnect between the eye and the brain. Sometimes they're due to a restriction of the eye movements, which is called a muscle palsy, and sometimes they're due to deprivation from nystagmus, or a shaking or an oscillation of the eyes. Eye turns can also cause amblyopia, which is commonly known as a lazy eye. So how do we treat eye turns? The first step is identifying what type of eye turn, whether the eye turn occurs all the time, known as a constant strabismus, or whether it occurs some of the time, known as an intermittent strabismus. Constant eye turns are more difficult to treat than intermittent eye turns. The reason being, when the eye turn is intermittent, the brain is using both eyes at some point in time together. It may be a small percentage of the time, but the brain is already adjusted and used to using both eyes together. In constant strabismus, the eyes are never pointed in the same direction, so therefore the brain has a much more difficult time to learn how to use both eyes together. The first step in treating an eye turn after identifying what type of eye turn is to correct any significant need for glasses. Correcting the farsightedness, nearsightedness, or astigmatism will allow the brain to have the clearest vision possible. When the brain receives a clear image and a clear signal from the eye because of the glasses, the eye turn is much more likely to become less frequent and much easier to treat. Sometimes when amblyopia occurs, we need to strengthen one eye, the weaker eye, by patching the better eye. This creates a stronger signal between the weak eye and the brain, which allows both eyes to develop properly and allow for what's called fusion, where fusion is the ability to use both eyes together at the same point in space to develop depth perception. Depth perception is the ability to judge visual spatial representations, which is important in cutting with scissors, playing sports, or driving. If after patching the eye, correcting the vision with glasses, the eye turn still persists, we highly recommend vision therapy. Vision therapy is the ability to retrain the brain to improve the vision, to make the connection between the eye and the brain much greater, and to improve stereopsis or depth perception. Sometimes, even after glasses, patching the eye, vision therapy, the eye turn is still present. At this time, we recommend eye muscle surgery or strabismus surgery. If eye muscle surgery is recommended for your child, we will discuss it during the comprehensive eye exams and subsequent progress evaluations for strabismus. As a specialist in pediatrics and developmental vision, a majority of the cases that are referred to me, remember that only 5% of children actually suffer from eye turns. A majority of these cases are diagnosed as pseudo-strabismus. Pseudo, the prefix meaning mimicking or masking. Strabismus, meaning an eye turn. So this condition masks or makes it appear like the eye is turning. This condition is due to the skin folds around the bridge of the nose. As the child is first born, and up to about age 5 or 6 years, the skin and facial features slowly develop. If the skin folds are present and much more prominent, sometimes it can make the white part of the eye appear unequal. So either side of the bridge of the nose, the skin folds are present, and these are called epicanthal folds, and between the eye and the colored portion of the eye, called the iris, the white part, the conjunctiva and sclera, is present. When this conjunctiva and sclera, the white part of the eye, is unequal, sometimes this appearance of an eye turn is the possible diagnosis. Only a true comprehensive eye exam with strabismus evaluation will be able to determine if this is the appearance of an eye turn or a true eye turn. One thing to consider: children do not outgrow an eye turn. Once it is present, it is always present. The ability to minimize the eye turn and use both eyes together, or fusion, only occurs after glasses, sometimes patching the eye, vision therapy, and sometimes even eye muscle surgery. We will discuss all of these treatment options at the strabismus evaluation. Some common symptoms associated with eye turns are headaches, eye strain, fatigue, and double vision. If you notice your eyes drifting, turning, or wandering, or notice the appearance of an eye turn in your child, family, friend, neighbor, or relative, we highly recommend a comprehensive eye exam and strabismus consultation as soon as possible. You will not go blind from an eye turn. However, we have to determine what is the true nature and cause of the eye turn. Sometimes they are significant. If you have any questions, as always, we at Cape Fear Eye Associates stand ready here to help you with all of your visual needs.